Hello everyone, so today let's talk about spontaneous bacterial peritonitis. Before we go to the mnemonic part, I just want to explain about this topic briefly for your USMLE exam. So, what is spontaneous bacterial peritonitis? So, let's say there's a patient who has cirrhosis and ascites, and he's coming to your OPD, and you find out that he also has fever, and then you check his pulse, and you find out that he also is tachycardic, and then when you look at him, you realize that he's also having altered mental status. Okay, and then this particular scenario that you see should in your head you should suspect that this patient might have spontaneous bacterial peritonitis, and all of this is happening without a surgical source of infection. Now you go and examine his abdomen, and you find out that he has diffuse tenderness, and also he may or may not have signs of peritonitis. But just because he doesn't have signs of peritonitis, please do not rule out marking spontaneous bacterial peritonitis. Just look at the whole thing as a whole. Okay, look at the whole scenario with all the factors. So we have a patient with cirrhosis coming to you with fever and tachycardia, has altered mental status without a surgical source of infection, and these findings. So what do? You want to do parasynthesis to rule out spontaneous bacterial peritonitis. So apart from that, you also find one more finding. Okay, you see that this patient is also having decreased bowel sounds, but he has dilated bowel loops, so there is no obstruction as such. But it is there's nothing obstructing the GI system, but you still find decreased bowel sounds. So this is classic for your functional ileus, which is functional obstruction, right? So he has a functional ileus right now. So this also can be a presentation in your spontaneous bacterial peritonitis. Okay, now when you do your parasynthesis, you can see that the neutrophil count is going to be more than 250, and also when you check the ascitic fluid proteins, you can see that it is very less. It is literally less than 1.5 grams per deciliter. Now what you do, you also feel like, okay, you know what, let me just take a culture also. Let's see if it is having its culture positive or what. So in 50% of the patients, the culture will be positive, and you can have these amazing organisms. So it can be E. coli, it can be Klebsiella, it can be Streptococci. And then you find out that this patient has spontaneous bacterial peritonitis, and then you decide to treat. So for most patients who are not very critically ill, you can give them third generation cephalosporins. Okay, but for the people who are very very ill, you can also add, you can broaden the spectrum. You can give them peptides and carbapenems, because they can also they can also treat pseudomonas and anaerobes. So you can give them peptides as well as carbapenems. Now, what about prophylaxis here? So do you do something to prevent spontaneous bacterial peritonitis in high risk patients? Yes, you do. So how do you know that someone is a high risk patient? So if a patient has a prior episode of spontaneous bacterial peritonitis, or when you see his ascitic fluid protein is less than 1.5 grams, and he has impaired renal or hepatic function, you can give him prophylactic antibiotics. And what are the antibiotics? So you can give him fluoroquinolones or TMP-SMX. So all of this I've just summed up in a small mnemonic. I hope this helps. So this is a mnemonic right here. So we can see that there is this patient who is coming, and you can clearly see that he has fever, and he is not looking like he's in a good mental state. So he has altered mental state as well. Okay, and so he has altered mental state, he has fever, and you can see he has ascites as well. So you're the doctor, you're checking, he's saying he has pain. Okay, so he can have diffuse abdominal pain, and then he can have signs of peritonitis, which is guarding and rigidity. And then this is a weird I'm sorry for this particular image, but I was trying to show functional ileus. So just remember, this thing is functional ileus. Okay, that can be present. It's not like it's present in all the patients, but don't be surprised if you find this in a question stem. So this can be seen, this can show up in the question stem. Okay, and then I've shown there is this nurse who's holding this board 250 and 1.5. So you can see this nurse also, she's smiling and she's holding this parasynthesis kit. So that is the next step what you do. Okay, you do parasynthesis, and she's also ready for culture. She's also ready for the culture here, and he's holding a board. So what does this show? So remember, the neutrophil is more than 250, that's what we discussed, and protein is less than 1.5. Okay, so these two values are already given here. Right, now next we talk about a board that is a fancy looking board in the behind. So here they're telling prevention is better than cure. So that's just my way of trying to explain about the prophylaxis part of spontaneous bacterial peritonitis. Okay, so we can see that here I've shown you some kidneys. So these patients, whoever have renal impairment or a hepatic impairment, should get prophylaxis. Okay, and also if a patient had a prior episode of spontaneous bacterial peritonitis, you should get prophylaxis. And also if you have ascitic fluid less than 1.5, so we can just write 1.5 here. 1.5. Okay, yeah. So, and why have I drawn flowers all around the board? Because the treatment or the thing that you give for prophylaxis is fluoroquinolones, fluoro, so flower. And I've also drawn clock here. So, that is basically showing time. So time is TMP SMX. So these are the two things that you can give for prophylaxis. So I hope this helps. Thank you.